we have Dr. Pat Ocampo joining us again, and she's going to share with us her evaluation wisdom and her tips and tricks on logic models and key theories to consider and all of those pieces that go into evaluation. So with that, I will just hand it over to her since we don't have too much time and there's a lot of pieces going into it. But again, feel free to have your video on, unmute, use the chat if you have questions. I'll be monitoring that as we go through. And I will hand it over to you, Pat.
Thank you, Ashley, and happy Monday to everybody. It's great to be here talking about something that is near and dear to my heart, evaluation. You know, as I was preparing this, I realized that when I spoke to you the first time on the social determinants of health, I was so excited about our Get to Know You activity. I didn't even take a few minutes to really introduce myself and describe my background, just in case you had not taken the time or had the opportunity to look at our short videos that we created. So I thought I would just start by telling you just a teeny bit about myself. I'm a social epidemiologist, and I've been working primarily on issues related to populations who are living with very low income in urban areas. So that has been my focus of research for many years. And then within that, I've focused a lot on maternal and child health. I've worked in the US on many different kinds of urban areas in the US when I was at Johns Hopkins before moving up to Toronto, where I am now, and was very much part of the MCH community, and the MCH community in the US is very near and dear to my heart. And so anyway, that's a little bit of background, but more to the point in terms of why evaluation. I've been doing evaluation for close to 30 years now in the MCH community. One of my very early projects was one of the very first Healthy Starts. It was funded in the 1990s. So that was a very interesting adventure to have very early in your career doing evaluation of that type of a complex intervention. And I'll be sharing a little bit about that with you today. So let's get started. And let me see if I can do my technology correctly today. Okay, can you see my first slide?
Yes, looks good.
Okay, great. So we're going to be talking about evaluating MCH programs and, you know, evaluation, as with many topics that we have had here in this training course, is a topic that we could be spending years talking about and learning about and building our capacity around. So when we think about a 2-hour session and what might work for a 2-hour session to try and hit home some of the key points, I thought one way to organize this session would be to go through the CDC evaluation cycle. The CDC evaluation cycle is something that could be known already to many of the folks here if you've been doing evaluation. It's not specifically a recipe for how to do a particular type of evaluation, and it doesn't even go into some of the key design issues. It's more identifying the relevant stages of evaluation. And what I really like about it is it identifies some of the key stages. So I think we'll follow this, and then I'll embellish it with some of the tips that we need to consider as we go through each stage. Now, hoping not to make this a session where I'm just talking at you. And so I want to hear from you about what some of the points are that are less clear that I'm talking about, you know, not even actually just for this live session that we're doing now, but I'm hoping many of you have had a chance to look at the, I should probably put this in the chat now that I think about it. So I'm just gonna.
I've got it. I'm getting.
Oh, you do. Amazing. Amazing. You're amazing. So in the Jamboard, you'll see opportunities at the front to put in, you can just grab a little Post-it and put it in there. What are some of the muddiest points that are not clear as we're going along, or maybe there was some muddy points when you watch the videos. So go ahead and put it up there. And one thing I like about Jamboard is it's more anonymous. Feel free to put your name there if you want to, or your state or your jurisdiction, whatever. But so we can use the Jamboard. And if we have some time, there's some exercises on there that we might do as well. So thank you, Ashley, for putting that in the chat.
And Pat, I may have you pause. We may have restricted access to your Jamboard, so you may need to change your privacy settings.
Okay, let's see.
Mine is doing that.
Sorry about that. Thanks for letting me know. Okay.
Hmm.
So, let's see. How do I do that in Jamboard? I think I have to look for. Let me just go back. Okay, hopefully you're in. Okay, so yeah, good.
Yes.
Mine worked.
Excellent, thanks. So we're talking about program evaluation then, and in the videos, we talked about how programs unroll in stages, and we'll talk a little bit more about that today as well. As we design our evaluation or conduct some evaluation, and what we're going to be focusing on today is making sure that our programs are evidence-based, right? When they're evidence-based, they're going to be more effective because we know that the strategies and programs are supported by some kind of evidence. We don't always mean necessarily that there's been a systematic review on that evidence, although that is very strong evidence. Sometimes the evidence comes from the field, from people on the front lines. Is our program implemented well? It's going to be a big theme of today. And then finally, is our program effective, which is something that I think all of us really want to know, and our stakeholders really want to know about. Is our program making the kind of impact that we want it to make? So when I created the videos, I was hoping that you got the message that programs unfold in stages, and that the stage that your program is in and the type of evaluation that you can do are linked. They're inseparable. And so there's a time and a place to do and think about outcome evaluation. And that's less so in the design phase than it is when your program is mature and functioning well. And there's a time and place for formative evaluation. That's less in when your program is mature and functioning well, and more when you're really starting to roll it out. So these two are interlinked. One question I have for you is, how will you know what program stage a program is in? It's kind of tough, because if you were to go to program designers or to staff and you're like, hey, what program stage are you in? They're probably not going to know. And even if you said, is it a mature program, steady state or mid-course corrections, again, they might not know. And that's okay. But they still need to tell you, right? So you need to ask them about the stage, or maybe how long the program has been in place, or what are your future plans, near future plans for your program. So you have a sense. You might have to assign the stage yourself, and as I mentioned, sometimes they don't know. They're just busy delivering services, which is where their headspace should be. So you might ask them some specific questions like, has anyone been served in the program yet? If not, they're probably still designing it. or how long has the program been up and running? Now, that's not necessarily a good indicator of what stage it's in. If somebody says, well, 4 years, that doesn't mean that they're not still undergoing some mid-course corrections. Some programs are constantly tweaking their programs and improving them, which I think is great, but that means they're still in that mid-course corrections phase. And then, but the phases are not fixed in time, or time itself won't necessarily tell you what stage a program is in. And then another question you might ask is, has the program undergone or been undergoing some sizable changes in recent weeks or months? And that might tell you that they're probably still in the mid-course correction phase, or they're out of that. If they're like, nope, we haven't changed it in months or years. And that means they're probably more in steady state. So there's questions that you can ask that don't necessarily refer to specific stages that you might want to keep in mind.
Pat,
So
and
maybe,
have
yeah.
a request on the Jamboard, having the access change from view only to view and edit. So folks,
Oh my gosh,
clickies.
what am I thinking? Yes.
Before we get too far.
Okay, good. Good timing to do this, because the next thing I want to do is share. There we go. And view. Okay, so change this. All right, now everyone can edit.
Thank you, Pat.
No, thank you. But actually, this is a good place to stop, because what I wanted to do was do a little kind of calibration poll, just to get a sense of what you got out of those videos, and get a sense of what I should focus on today. So maybe if you can go to, I promise this is the last tool we'll use. We won't just be using all different tools today. So if you can go to the Poll Everywhere area, and there's some polls that we're going to do. The first one's already open. And did everyone get the link? And if so, I'm going to stop sharing my slides and I'm going to go to the polls now. All right, so programs are always rolled out in stages, and the length of stages is always fixed. It's kind of a trick question, isn't it? Because it's double-barreled there. I have two things in there. Yes, I would say that for the most part, the piece that's false here is that the length of the stage is always fixed. All right, let's go to the next poll. Let's see if I can do that here. Here we go, next. All right, so the next poll then is about, it is important to design and start the outcome or impact evaluation as early in the program as possible to avoid problems and delays. All right, I think it's more stable. So the point that I tried to make in the videos is that we really should think about outcome and impact evaluation when the program is in steady state. And we'll talk today why that is. and what the consequences are of starting too early. So I would say the correct answer, the mostly correct answer to this one is B, is false. All right, let's go to the next one. Annoying messages. Okay, this one is the purpose of implementation evaluation is to catch and correct implementation weaknesses and to give the program the best chance of succeeding. All right, so looks like mostly people said true for this one. Yeah, I think I would agree with this one. Implementation evaluation is a bit different from process and formative, where the purpose of it, and maybe formative is a little bit like it, but it's different, and we'll go over those differences. Really about monitoring carefully implementation to make sure that few things go wrong. All right, we have, I think, one more. Yes. If your program is in steady state or mature stage, you can do a process evaluation. This one kind of is a trick question, isn't it? So I would actually give you credit if you answered either one of those, because I made such a big deal about only doing certain things in certain phases, and where I showed process evaluation was within the mid-course correction stage. But the real answer is you could do a process evaluation as part of your outcome evaluation, even if the program is in steady state. And we'll go into that as well. So thank you for weighing in on those questions. And let's move on to the rest of the presentation. All right. So I need to share. All right. Hope you see my slide now.
Looks good.
Okay. So we are going to go through the evaluation cycle, beginning at the top with engage stakeholders. Such an important step. And know that probably the first 3 stages here, engage stakeholders, describe the program, and focus the evaluation design. You can probably interchange those. If you have a program already and it's described and you haven't engaged stakeholders yet, I think that's fine. Or if you already know, I am absolutely going to do an implementation evaluation on this program, and you haven't consulted stakeholders yet, hopefully you described your program, that's okay. So you can start at any one of those first 3 areas. So engaging stakeholders, how do we do that? Well, there's a number of different strategies you can consider. I think it's always a good idea to do stakeholder mapping, you know, brainstorm all of the different stakeholders for that program, and then prioritize them, because you can't please every single stakeholder, but you can identify your primary set and make sure that you understand that it's that stakeholder that you want to engage, or that stakeholder you would like to make sure you know what they want to know about the program, because that stakeholder is going to be hopefully using your findings or amplifying your findings. It's important to know that each stakeholder is unique and their priorities are unique. Stakeholders can help you with your evaluation. If you're stuck in a particular area, they might help you problem solve. They will use your evaluation findings, and it's ideal to somehow keep them informed of what's happening all throughout your evaluation. So engaging stakeholders, even though it's step one, isn't just happening at the beginning and then at the end. So you might, the other thing I wanted to mention is the CDC has some great tools. So I'm just showing you one page from the evaluation cycle set of resources that are on the web, and there's dozens and dozens and dozens. This is about the evaluation steps, and you can see the steps are here. Engage stakeholders, describe the program, focus the evaluation, and it goes on. And you can download a little checklist from the for each stage, and the checklist is super handy. So it tells you some of the things that I just put in my last slide about what you want to do in terms of thinking about your stakeholders and identifying their priorities. So I highly recommend these nice, concise checklists. So, you know, you might create this little matrix here about the stakeholder, whether they're a primary or secondary stakeholder, and what do they want to know about the program, or maybe what do they want to show about the program? That is, might be a funder who wants to show that they funded a great program. And you might want to note how they might assist with the evaluation, on and on. So you get the idea. It's a fairly straightforward but really important activity to do early on. And as you engage a stakeholder, you might ask them if there are other folks or other groups who might want to know about the program. You know, I wanted to emphasize another point about stakeholders and about evaluation in general. So here's a little bit of a matrix. It says who the stakeholder is. So on this slide, it's clients, program staff, and program managers. And the second column is, you know, what might they want to know? So program clients want to know, does this program provide us with high quality service? And are some clients provided with better services than other clients? And if so, why? So they may want to know about equity. Program staff also want to know if they're providing high quality services to their clients. Also, are there inequities that have been noted? And then should staff make any changes in how they perform their work? So you get an idea about what their priority interests are in an evaluation. But you know, evaluation doesn't always have a great reputation. In fact, I would say more often than not, I've encountered resistance to evaluation. I'm involved in an evaluation right now, and it's an interesting and urgent and important evaluation, in my opinion. It's trying to look at how services in Toronto that serve women who are facing violence, living with violence, and we know that during the pandemic, violence rates have tripled in many areas. So how has the violence against women sector pivoted their services, and how effective have they been? And they are we're working with these stakeholders, these service providers, and they are not wanting to use the word evaluation, even though everything that we're doing is an evaluation. They really don't like the word. Now, we didn't go into the history of why they don't like the word, but I think being mindful of how some groups are not really that open to evaluation and why is important to know. So I have in this other column here some sample anxiety and reassurance questions that are maybe in the back of their mind, these different stakeholders, and may not come to the forefront so easily, but you need to know that they are there if you're doing an evaluation or part of an evaluation team. So for program clients, they might be asking, is this evaluation being conducted because the program's doing a bad job and our clients at risk? Or will the results jeopardize my chances of receiving these services to meet my needs? Or will the evaluation results be available to clients and potential clients, or will shortcomings be swept under the rug and hidden? Program staff might think, is this evaluation being conducted because there is a suspicion that staff is doing a bad job? Or could the staff be punished or blamed because of program shortcomings? They too are going to want to know what transparency levels are, et cetera, et cetera. Program managers could be concerned that they're not doing a good job, or that they're being blamed for shortcomings. I think a big concern of a lot of program staff and managers is the evaluation being done because they're going to cut this program? So I think being aware of different stakeholders and what their stated priorities are, but also what their anxiety and reassurance questions are, so that you can address those and be transparent, will be really important.
A question in the chat from Julia: what would these groups prefer to name it if not evaluation?
We've asked that question, and there are trust issues. I mean, I think it's a sector that's chronically underfunded. They are worried that this might be done because our focus is on how did you pivot and did you have enough resources? And we're just curious because we know there's chronic underfunding in this sector, and we're not the funder. And we're also telling these service providers that they'll have the data, they'll have total control over how it's released. We were funded to do the evaluation because it was a COVID context, and there's some lessons that we can learn in terms of pivoting services. And we were hoping that our evaluation might help other sectors, other VAW sectors in other cities. But they really object to the word evaluation and just say, we're not doing evaluation. So it's not clear. We call it research, we call it a project, and we're doing a partnered project, and they know we're doing data collection. They help us with the data collection instruments and help us with data collection, but we're just not calling it evaluation. And evaluation is a bad word in some communities. And again, so you should be aware of that. Again, they may not, this didn't necessarily come up on day one. I think there has to be a little bit of trust built before some of these issues come out. But as you engage with stakeholders, you need to be aware of both their levels of enthusiasm and then their levels of concern and reservation. Evaluation can be scary to a lot of people when they're not reassured that evaluation is not being done for the reasons in that second column. Mm-hmm. Thanks for your question. Okay, so I guess another issue that I wanted to raise is, more and more there are questions about, are our methods that we use culturally competent, culturally responsive? Are they addressing some of the inherent issues of racism that we see in our research? For example, maybe some of the evaluations don't try hard to get those who are traditionally marginalized. So we're just studying the groups that are easy to reach, for example. And how can we overcome that? And I wanted to call your attention to an excellent group which comes out of Illinois, the Culturally Responsive Evaluation Association. So I don't know how many of you are hardcore or even medium core evaluators like I am. I'm a member, for example, of the American Evaluation Association. It is a fantastic resource. They have all kinds of resources available. So I highly recommend it. And then there's another group, the Culturally Responsive Evaluation Association, who's providing some alternatives to make sure that our methods are culturally responsive, and are making sure that we use the right kinds of tools that are appropriate for all populations, and really taking kind of an anti-colonial, anti-racism approach. So I suggest you check out their resources as well. Okay, we are going to move to the second phase, and we are going to describe the program. Actually, maybe I'll just take a quick peek to see if anyone put anything in the Jamboard yet. Yeah, okay. So, all right, we're going to talk about what each type of evaluation means and does. And in the evaluation files, there is, I think, an evaluation type list, and it defines the different types of evaluation, but we will be talking about when to do each type. And when to start planning for later evaluation needs. Yes, let's talk about that too. How do I start the evaluation process for a program that has been going on for years and recently has had a big change? Where do you begin? Fantastic question. So as we get to the, after describe the program, let's deal with some of these questions. Thank you for posting those. Okay, so now we're on to describe the program. This seems like such, an obvious step. Why do we even need to say it? We're doing program evaluation, and why wouldn't we know what the program is? Well, you'd be surprised. Let's first get at the why. I don't know if you've ever read that book, Start With Why, but I think it's a really important book, and let's start with why. Why should we describe the program? Why should we generate a comprehensive program description? Well, one is we want to share a common understanding of the program with all stakeholders. That is, program staff, program clients, program funders, programs that are like your program should have a common understanding of the program. Now, maybe not the exact same. You might want to share more details with your staff than you're going to share with your clients or maybe even your funders. But everyone should have a common understanding of the program. And as you shop around your program description, often stakeholders contribute and help you improve your program. So your program description, and I'm saying the program description is comprised of something like a logic model and theory of change, because they're not the same. They inform the evaluation activities. Also, your program description should reveal your program theory. There are many similar programs that are actually based on totally different theories of change. I think smoking cessation is a great example, because some smoking cessation programs are totally behavioral based. We're just going to set a quit date, and then we're going to remember that quit date, and we're going to quit on that date, and we're going to have all our gums and things like that around us so that on that quit date we can stop. There's some that are behaviorally based, that are some that are actually recognizing the nature of the addiction to nicotine, and so they approach them more like an addiction program. And those are two different theories of change. So the underlying theory of change may be different in different programs, even if they're both smoking cessation programs or vaping cessation programs, I guess. And then it's important to understand how that change is going to happen. Not just I'm doing case management and then I'm going to go do a home visit or two. Those are the strategies, but that doesn't say how those home visits or those case management activities are going to lead to change. And it's important to know that as well. So comprehensive program descriptions will do all of these things. Now, a comprehensive program description, seem to be stuck here. There we go. Is comprised of two components. It's your logic model and your theory of change. And no, they're not the same. Okay, they're not the same. So we'll talk about why they're not the same. I think there are many folks who kind of conflate them, and I can understand why. But a theory of change tells you how and why change will occur. And it's going to take your set of activities and explain why each one of those is important, why each one of the strategies leads to one of these short, medium, and long-term outcomes in your logic model. And it's based on evidence, ideally, and it can be gotten from the literature, or maybe it's based on experiences of frontline staff. But a theory of change is how and why change is going to occur from your strategies. And the logic model are the details and the resources and the planned activities, and then the outcomes over time, short, medium, and long. And we've kind of seen that grid matrix that often is the logic model. So a program description is the logic model and the theory of change. Okay. So here we have a logic model. This is the logic model for this MCH training program. This was actually the training program before we pivoted to Zoom. And it's not comprehensive. It's really just meant to be an example, because I'm pretty sure everyone has probably seen a logic model where we have your inputs and your outputs, activities, and the short, medium, and long-term outcomes. Now, this is great for showing your activities and what you're going to do and what you hope to achieve, both for participants during the program, that's the short-term outcomes. And then, right after the program, hopefully you'll retain knowledge or maybe access technical assistance even after the program, so you can retain and reinforce the knowledge you've gained. And then in the long term, after there have been many trainees who've cycled through this program, we want to impact the maternal and child health indicators and capacity of communities across the US. So what's the difference then between this logic model and a theory of change? Okay, so we have this little comparator here. So for a logic model, it is time bound, or in this case, we said short, medium, and long. Ideally, we would put timeframes on there. The level of detail is high. There are many elements, and it's kind of graphics and text. And the focus is very specific. We're targeting those specific outcomes. A theory of change model is not necessarily time bound. And the level of detail is low, because what we're really focusing on is how those strategies actually lead to some of those outcomes. So what do I mean by that? Well, we might take one of our strategies. So we're going to do this thing and we're going to get those results. So we might have lectures, right? We're having lectures as part of this program. And as we do that, we're going to increase knowledge and skills of the trainees. So lectures is going to increase the knowledge and skills of the trainees, but it doesn't say how. And that's where the theory of change comes in. So behind the idea of lectures, we've made some assumptions about why lectures will increase knowledge. We might have gotten that from research or from practice. A lot of the faculty here have been teaching forever. Theory, there's theory around why lectures are a good way to increase skills. And what we come up with in terms of the why in this case, in this training program, lectures are increasing skills is because, at least when we pivoted, we actually designed these lectures for online delivery. They're based in adult learning practices, and they have been over the years, because we've been doing this for well over a decade. We also stratify learner levels. This is the introductory course, and we have an advanced course. So we teach to the appropriate level. Plus, the lectures are coupled with skill building exercises, more easily done in on-site than it is, but we still do it through Zoom. And there's group learning opportunities, which is different from just listening to lectures. And then it's tailored to your priorities, right? We asked you in the beginning, what do you want to hear about? And so we tailor them to your priorities. So for all of those reasons, these lectures are going to lead to increased knowledge and skills. And then we got that information from systematic reviews about lectures, prior evaluations, what worked, what didn't, theories, expertise of frontline workers. So there's all kinds of sources of information about the theory of change. So in this picture here, theory of change is more about, is in this sort of triangle here, and they inform the strategies and results that we see in the logic model. So we go back to our logic model, and our often there's like an assumption section of the logic model. You know, that's okay. You can put your assumptions there about why we think change is going to happen. There are other ways to do it as well. And I'll go over that in a minute. But when we focus on our assumptions or our theory of change, it's an opportunity to make sure that our beliefs about why lectures are going to bring change are really plausible. Does that really make sense given the context in which we're doing this? And then when we focus on the strategies themselves, so the logic model, we can understand, test on underlying ideas of feasibility. So is it feasible to do all of these activities in these 3 weeks in 2-hour Zoom sessions 3 times a week? So that's the other advantage of writing everything down, is that you can check on feasibility and you can check on, plausibility. Okay. So you don't have to be limited to these kind of matrices when you do logic models. I just grabbed some logic models from the web, and you can see that some of them are more creative. They bring in artwork. They're more interesting to read. So this one is a Museum of Art and History logic model about how it impacts the well-being and knowledge of the community. There's one here about schools and the logic model, how it's going to affect, again, the community and the students and the teachers. And then finally, this one's an interesting one. This one is suggesting that the activities and the outputs lead to short, medium, and long-term outcomes. And then we go through it again so that it goes through a different set of short, medium, and long-term outcomes. And we go through the cycle again, and it comes up with a different set of short, medium, and long-term outcomes, because hopefully you're moving the needle after you do the first iteration of the program. So there's all kinds of ways to depict logic models. We don't have to stick to the traditional matrix, although it's convenient. But maybe when you're sharing with some of your stakeholders, you might want to take on a more infographic or artistic approach to creating your logic models. Okay, so let's see if there's some muddy points. Quantifying outputs versus outcomes in the logic model. Yes, so, you know, I didn't put like SMART objectives and things like that, but yes, that would be ideal if this is the question you're asking, and that is, could you say something like increase trainees' knowledge of multivariable analyses by, I don't know, X% or X points, depending on how we're going to measure it, right? Or more people will be familiar with the assumptions of multivariate analysis models. So yes, you can and should quantify. That makes it far more explicit about what is a magnitude of change you're expecting. Certainly, I know that when people first create logic models and it's their first time doing it or it's their first program, sometimes they're overly ambitious. So like there'll be an 80% improvement, for example. And if that's what you're going for, you have to make sure that your activities actually match that. So definitely quantify when you can. All right. So now we are moving on to focusing the evaluation design and gathering credible evidence. So that is the real key. It's like, okay, what kind of an evaluation are we doing? So this is starting to get at some of the muddy points that were identified earlier. So I guess the first things I want to say about that is you are going to take many things into consideration before you decide what type of evaluation you're going to do. and when you're going to start planning and all of that. You're going to take into account your program stage and the resources that are available to you. So what kind of money is available, or what kind of staff are available? What kind of data do you already have, or what kind of data do you have to collect for the purpose of the evaluation? And what is the capacity of the evaluation team, whether it's the small core team or other people who are going to help you along the way? That's just one consideration. Another consideration, moving to the right, are stakeholder priorities, right? We already talked about certain stakeholders are going to have different priorities. And so who's your most important stakeholder? What is that group's priority? Are they interested in outcomes or implementation? Or maybe it's a funder who wants to replicate this program in other settings. So those are different priorities. And then also, what is your program logic model say and your theory of change? So you want to take at least that information into account before you decide, what is my evaluation type? Am I doing an implementation evaluation? Am I doing an outcome evaluation? And the designs that are available to me, okay? And the other thing you need to know, and this makes it tricky, each evaluation really seems like it is totally unique. And that makes it hard, because it's not like you can say, oh, I can do exactly what they did over there or they did over there, because each evaluation has unique program stage, resources available for evaluation, different stakeholders, on and on. On the other hand, though, we do see patterns and approaches given some of these priorities, conditioned on some of these considerations. And so that's the good news. We can describe tendencies about what we should and shouldn't be doing, and when we should start planning. And even if a program has been in the field for a long time and now they're making a change, what do we do? People have been there before, and so we can learn from them. So let's go back to our program stage idea. So if your initiative is forming and under refinement, right, you're in the mid-course correction phase, so you want to try formative evaluation or implementation evaluation. Or if your program has been established and is mature and not changing, then you want to try summative evaluation. Now, if your program is mature and stable, but then they decide to make a big change, it pushes that program away from mature and predictable back into the program is improving. So you might not want to start a summative evaluation yet. Actually, let's talk a little bit about that. Some of the reasons why you shouldn't start a summative evaluation when you're improving or enhancing the program. And again, some of this might seem obvious, but I think it's worth stating. And, you know, I'll never forget when I did that very early Healthy Start evaluation. There was a local evaluation. So I was the head of the local evaluation. There were 15 programs at that time. I mean, there are hundreds now, right? Or at least over 100. And so at that time, there were only 15. And there was a local evaluation, and we were allowed to look at some outcomes. And then there was a national evaluation, and they could look at infant mortality, because infant mortality prevention was the primary outcome of interest for Healthy Start at that time. And you know, 2 years into the program, the first national evaluation report was due on outcomes. But you can imagine the programs formally had 9 months to plan. But, you know, 9 months to plan a multi-level, multi-sector, huge program is just not enough time. They could not get through that mid-course correction phase in 9 months. No way. I don't think there was a single program, you know, even though some of them were functioning before, they were now doing different things because they got a lot of money. There was a lot of money the first round. And so, Baltimore got $50 million at that time, right, in the 90s. And so that's a lot of money to spend. You design a very complex program. In 9 months, you can't work all the kinks out. But the first national evaluation outcome report was due in 2 years or 2.5 years, something like that. So they started that outcome evaluation during the mid-course correction improvement phase. So what does that say? Who are they comparing? I mean, I want to know, they had a control group, who's the treatment, who's in the control, and the treatment group, different people are getting different things because they're still improving the program. So what is the definition of treatment? You're actually not comparing the same kind of intervention in that treatment group. You're comparing apples, oranges, broccoli, celery, all those things in the treatment group, because as you're evolving the program, all the treatment people are getting different things. And so does that make for a strong outcome evaluation? No, it makes for a very, very weak outcome evaluation because there's no homogeneity in the treatment that people are getting in the outcome evaluation. So it's very important that you start your outcome evaluation when a program is mature and not changing, because you want everybody in your outcome treatment group to get the same intervention. That's going to maximize your ability to really test the program. Okay, so that was a waste of millions of dollars then for the Healthy Start program to do their first outcome evaluation 2.5 years into the first Healthy Start. Because guess what? They showed that it didn't work, right? And we know why. Not because the program didn't work. We actually don't know if it worked or not, but because it was a poor design. It was mistimed. All right. So let me say one more thing then. And we'll talk about this later if we have time. And that is, there's actually a type of program that is constantly innovating, and it's complex and multi-level, and it's in development. And so you're really creating, exploring. In fact, there are times when you don't know what works because you're in a brand new situation. I think COVID is an interesting situation. We were facing a global pandemic. We go back to that situation of the violence against women sector. Actually, there were some public health emergencies in the past, but not much had been written about what the VAW sector had done during that time. We do know that from monitoring data, when there were public health emergencies and disasters in the past, and that sector had to pivot and shut down, that there was a lot of violence increase then too, towards women and girls. And that has been well documented, but nothing has been written about how do you pivot services to prevent some of that increase and to create better support for women and girls during times of public health emergency. So we're in a new innovating situation. And at that time, you want to try a totally different approach. It's called developmental evaluation. And if we get through the standard slides that I have for you today, I want to explore with you developmental evaluation and what it is. So keep that in mind. But we're mostly going to focus on formative, implementation, and summative. All right. So let's talk about process evaluation. And by process evaluation, I mean formative, implementation, and process evaluation. And I have the celebration bells there because I love process evaluation. Process evaluation, they have common approaches, formative, implementation, and process, but I would say their purposes differ. And there's a whole thing about language and evaluation. We have a lot of different ways to call process evaluation when they have different intentions. And some people use that language, some people don't. So be mindful of that. Same thing with logic model and theory of change. Some people just say they're the same thing and some people don't. Now, formative is usually, and I ordered them for a reason, because very, very early on in your program, you might want to use formative evaluation because you're still working out the kinks in one or more program components, and you need some data to assist. It's usually not published or not reported on. It's really just, let's collect some data to see if we're on the right track. So implementation evaluation is where you actually monitor or kind of use evidence to choreograph implementation, to correct weak implementation and to minimize implementation failures. I'm going to share with you some horrifying data in a moment that shows you just how many implementation failures there are. It makes me think that we need implementation evaluation always. So let's talk about that. And then process evaluation. How well was the program implemented? Often it's not necessarily about correction. You're just documenting how well did they do. And it's a great companion to outcome evaluation, because if they did fantastically in terms of implementation, then your outcome evaluation has a good chance of measuring the true impact of that program. But if they didn't do so well, which many programs don't do so well in implementation, then in some ways, we're going back to that situation where the outcome evaluation is not going to be useful. You can't believe the results. All right. So some of the domains of kind of formative implementation evaluation are, were the program activities accomplished? So for example, was the training fully executed as planned? You know, some of these questions may seem obvious, but you'd be surprised how many times, how often something comes up. You know, yes, we planned 4 trainings for our staff, but we got delayed and designing them took a lot of time. So in the end, everyone got like half an hour. Okay, what was the quality of the program components? So we might look at the trainee evaluations to see how the trainees are perceiving the delivery of our sessions. How well were the program activities implemented? So we want, did the lecture content really align with the standards of the field, for example? Was the target audience reached? We want to look at your data to see who enrolled. Are you doing the jobs we think you're doing? And then how did external factors influence the program? So the training environment, now we're in a Zoom environment, you know, the time that you have available for looking at the pre-lecture materials. And one year, even the weather disrupted what we did. We were in New Orleans and then there was a hurricane on the horizon and we decided to abort the training session. Thankfully, the hurricane never really materialized, but we disrupted and interrupted the whole training that year. We didn't do the training, or we only did 2 days of it or something like that. Okay, so this is really important. If you're napping, please wake up. This is so important because why do we need implementation evaluation? There are 3 frequent serious flaws in program implementation. And let me tell you that I'm getting this data from the education field, although there's data coming out, and I'll show you one study from Maternal and Child Health that's showing the experience from the education field is common in other areas as well. So the 3 frequent serious flaws in program implementation are that there's no to little treatment, even if you're in the treatment group. You know, how could that happen? Well, you know, we were going to get $100,000 for this program. And then by the time we got it, the funder cut the money. And then when we hired people, their salaries were higher, on and on. And so really, you know, we only had about 1/3 of what we really needed. We did the program anyway, but there's too little treatment. So if we were to draw up the logic model, which says how change should happen, we're not delivering that logic model. The wrong treatment. So people might, maybe you're screened into a program, but your screening instrument is terrible. So you're giving treatment to the people who don't have the condition you're wanting to treat. Or the treatment is not standardized. If you have multiple sites, maybe training is just up to each site. So it's not standardized. So people at different sites are getting different interventions. It's called type 3 error. So the program is described, maybe there's even a logic model, but it's not implemented. And in the field of education, and where they pay a lot of attention to these things, that happens more than 75% of the time. So if you think about all the outcome evaluations that are done, maybe there's a lot of errors happening in those outcome evaluations because we haven't been paying attention to implementation. Some of you may be aware that implementation science is on the rise. In the last decade or so, there's been an explosion of focus on implementation. Why? Because of this problem. I would say it's very, very high that there's probably some implementation failure in almost all programs. The sad truth is we often don't do formative implementation evaluations, so we don't detect it. We just assume things are going swimmingly. Let me give you an example of a meta-analysis that was done. And this is just on one component of implementation, and that is staff training, okay? You need your staff to deliver the program. You need your staff to change their behaviors to deliver a new program. Programs are about making change. So you don't want your staff to do status quo. You want your staff to change their behaviors. And so again, this is the education field. So what we have here is when you train, how much impact is there on staff knowledge? How much impact is there on the ability of staff to demonstrate a new skill? And how much use is there in the classroom when you have different modes of training? So one is just theory and discussion. That is, I'm going to come to you and say, okay, from now on, we're going to not do that anymore, but we're going to do this. Got it? So when you do that, you might have 10% increase in knowledge, and you're going to have 5% skill demonstration. Maybe that 5% is comprised of people who already knew how to do that, not because of that discussion, and then 0% use in the classroom. Okay, what about if you did theory and discussion and you demonstrated it in training? Well, you have more knowledge increase, 30%. You have 20% can demonstrate the new skill, but still 0 uptake in the classroom. Okay, what if you added on practice and feedback in training? So we have longer training sessions, you get feedback and you practice. Well, knowledge goes up to 60%. Yes. Skill demonstration, yes, 60%, but only 5% use in the classroom. It isn't until you actually have coaching in the classroom that you have knowledge at 95, skill demonstration at 95, and because you had coaching in the classroom, you're actually using those new skills in the classroom. So 80% or more of trainings are more theory and discussion or demonstration and training. We hardly have any coaching going on. So you can imagine that for the most part, staff don't get the training they need, and so they're probably not doing the new skills. Okay, so now let's go to the Jamboard. On the Jamboard, there is a board that looks like this. So can you tell me what are the implications? There's actually 2 boards, so you don't all have to go to the first one. The first and the second one are the same. Can you tell me what are the implications of a high program failure rate for outcome evaluations? I'll give you a couple minutes to weigh in on that. And feel free, if you have any questions, to unmute and ask me. got some great answers here. Thank you. So we've got some incorrect implementations for improvements, for program change, implementation not done well, right. So we've got a lot of loss going on here too. Loss of funding, lack of community support, end of the program, loss of position funding. Yeah, program seen is not working. Public health is missing out on programs that actually work. Yeah, that's right. Community loses resources the program provided. Yeah. Cancellation, sunsetting of the program. Yes. Yeah. Yeah, and the outcome, spend money on the wrong thing. So the outcome evaluation is likely to be very wrong if there's poor implementation. And again, too often when, you know, I know that when I go, I'm asked to do an evaluation, the first thing the funder or the program staff want is an outcome evaluation. Often they've been working for a while and they're like, we never have had an outcome evaluation, and they want an outcome evaluation. And so when I start asking them things like, well, do you have a logic model? And, you know, going through the steps, who are your main stakeholders? And often they haven't thought those through. And often they don't have a logic model, or they have one that they wrote on day one, but they've been doing mid-course corrections and they haven't kept it up to date. And I would say, I don't remember working with a program that has actually done implementation evaluation. So part of my job is to teach them about some of the things that I taught you about the importance of implementation evaluation, hopefully in a non-scary way, right? Like if I were to say, well, you know what, 90% of programs fail and yours probably fail too, they would immediately feel inadequate. So you don't want to say it in that way, but you want to, and I usually flip it around. I usually say, have you thought about implementation evaluation? Especially because you're still revising your program, and implementation evaluations are a way to guarantee the success of the implementation of the program, because that's what implementation evaluation is. And I'm going to tell you about that in a moment. We really take the program and we, you know, maybe using like QI cycles, improve the program over time so that implementation is strong and it really has a chance. The program has a chance of making the change that the program staff, clients, and funders want to see. So there's ways of flipping these around to make it enticing rather than threatening. So you have to keep that in mind. Let's see. Thank you very much for your answers. Excellent. So I'm going to move on to implementation evaluation, if you don't mind. There we are. Okay, so there are many frameworks for implementation evaluation, and like there's a consolidated framework for implementation research, I think, which is very popular. The one I like is Active Implementation Framework. And there's something at the bottom here called AI Hub, Active Implementation Hub. I highly recommend you go there. There is tons of resources there. And again, they're from the education field. So I've had to adapt this to be more appropriate for public health. But there's videos, there's tools, there's worksheets, everything around the active implementation framework, implementation strategy. Now, one of the things that the AI folks say, when I say AI, I'm not talking about artificial intelligence, active implementation, which is something I had to learn too, is that often we think of implementation as starting when we start serving the first person. But actually, the AI folks, the active implementation folks, and it's a national network, right? And they bring lots of people together and they have great webinars and things like that. They actually say implementation begins even before you know if you need that program. Whoa. So these are 4 phases: exploration, installation, initial implementation, and final implementation. Exploration is assessing the need of the community or the population, whether or not there's a great fit with either that clinic or that setting or that, the service environment, whether and how those staff have made changes in the past. For example, did they do coaching on site, or do they even have the ability to collect data on implementation so they can monitor implementation? It really assesses fit, strengths, and weaknesses to say, should we actually do this program? Wow, I don't think I've ever had anyone, I haven't worked with a program that asked that question. Usually they're like, we need better mental health services. So then they just start doing things differently. So you have exploration. Installation is all about doing the planning. If you identify weaknesses in exploration, let's say you don't have a management information system to monitor implementation, well, then try to get the resources available to get some kind of data collection system in place so you can monitor implementation. So you've done your planning, assessing fit, deciding whether you should go ahead and make the change. Then you can start doing the implementation. You have to do the training that happens in installation. Training and coaching, you have to be prepared to coach in initial implementation. Initial implementation is about working out the bugs, and then final implementation is about making sure that change is sustained and that people are continuing to have those practices that are aligned with the new program. So it's intense, but that's really what it takes to implement programs. I told you that in maternal and child health, this is a systematic review about fidelity of intervention. So fidelity refers to the extent to which a program is being implemented as designed or intended. In other words, am I following my logic model? And again, this is where the comment from one of you who said, do you want to quantify the change in the logic model? Yes, you want to quantify the change in the logic model. Then you'll know how many trainees are you going to reach, who's going to change. And so you know what kinds of change you're expecting and how many people you're expecting to serve. And so fidelity is a chance for you to measure how close am I to actually implementing the program the way it was intended. More recently, I've insisted on fidelity assessments for all my evaluations that I'm involved in. And again, if you sell it as a way of making sure the program is being implemented in the best possible way, the data's welcome and very, very useful to the program staff, because everybody wants a successful program. And so it's really useful. But what is this saying? So they did a systematic review of programs to prevent and reduce stress and anxiety from pregnancy up to 2 years postpartum. There are many programs like that. And so this systematic review looked to see how often were programs adhering to high levels of fidelity, or did they even measure that? So their findings were that the fidelity of interventions to reduce stress and anxiety during pregnancy and postpartum is low. One of the reasons why this systematic review is done is because they were concerned about the findings in this field being all over the map. You couldn't say that this program works, this one doesn't, because the findings were all over the place. So then they said, okay, well, let's see, have they been looking at fidelity components? So it says training of intervention providers is particularly problematic as healthcare professionals deliver many of the interventions. Improvement, enhancement, and assessment of fidelity is needed to enhance intervention implementation and reduce stress and anxiety in pregnancy and the postpartum. So essentially what they're saying is these programs to prevent stress and anxiety, well, they're not implemented very well, and they're not measuring and monitoring the way in which they're implemented. So we need to do more of this. let me just look at the time because I wanted to, I think I may skip over this. I was going to go into details on how to do fidelity assessment, but maybe what I'll do is just share the highlights. You can look at 4 components of fidelity assessment for clients. So adherence, dosage, I planned on having 4 sessions with our clients, but our program was cut, so we only do 1. Quality, how well was the intervention delivered, and responsiveness. To what extent are participants engaged, or do they skip the sessions, for example? And then there's overall program. Who did we reach? How do we know that each component is actually a different and unique and achieving their unique goals? Are we able to say that people who receive this program really are receiving something different than people who don't? And then, did I do any adaptation? And if so, is it still aligned with what the critical ingredients of the program are? So I was going to share some slides with you about how you do that, but it's kind of tedious, and I think I'd rather move on to other components. And this kind of tells you, in the end, you can identify program level fidelity as poor, adequate, or exemplary, depending on how you measure those components. And that systematic review was letting you know that many programs are in the poor area. So they don't implement well. And it goes back to the data from the education field, suggesting that a high proportion of programs have some type of program failure. And I think for me, the conclusion is without some kind of implementation evaluation, we're not going to catch and correct those errors. Okay, so we can use quantitative data. There's actually qualitative fidelity assessments too. And so it doesn't have to just be quantitative, although we're FEs, so we like quantitative, but don't overlook the importance of qualitative data as well. Okay, summary of process evaluation. Too often, process evaluations, and when I say process evaluations, I mean the set. Formative, implementation, and process are overlooked. People aren't interested in process evaluations. Programs are complex and prone to implementation failures. Process evaluations reveal weaknesses and provide opportunities to course correct. Knowing about the process of a program is also key to understanding other evaluation findings like cost or outcome and impact evaluations. You need to know if programs are being implemented well or poorly. And a variety of different methods and frameworks and tools can be used, are available for this purpose. AI Hub is part of the National Implementation Research Network. Fantastic set of resources, highly recommended. So I'm going to say to you, when you are deciding on your evaluation types and focusing your evaluation, make a pitch for implementation or process evaluation. All right, so now we have another activity. How are you doing? Our activity is on Jamboard. All right. So here too, I've got 2 of the same thing. You have, okay, look at the one where you have the friendly faces there. Those people are your primary stakeholder group. They're the program designers and the program staff, and they're coming to you to do an evaluation. And this is what they say to you. You can see it in the text bubble. Our program has been operating for 4 months now, and we want to show our funders how wonderful it is with an outcome evaluation. Can you please conduct an outcome evaluation for us? And so what would be some of your responses to this question? So you decide, is it too early or is it the right time to do an outcome evaluation? They've been in the field for 4 months and they only want an outcome evaluation. That's it. What might be some of your responses to that question? Does everyone see that on the Jamboard? I'll check the chat. Okay, thank you for the thumbs up. Loving these responses. I don't have, not one person says, great, let's get started on that outcome evaluation. I would ask what outcomes they have so far. Okay. Has your program made significant changes to implementation recently? Okay, great. We're knowing what stage it's in. How about an implementation evaluation? Okay, great. Let's get started on that outcome evaluation. All right. Can you tell me more about your program? Let's start with the process evaluation before we do. I would recommend waiting to conduct an outcome evaluation until more data can be collected and the program has been well established. Okay. Would most likely push for an implementation or process evaluation. Great. I would ask how their implementation process is going. Okay, great. Sounds important to work toward an outcome evaluation. Great. Going back to the logic model. Yeah. You know, logic models are not easy to generate. I've certainly been in many situations where the program staff can tell you what they're doing. If you sat down with them, they'd be like, well, I first screen the client. Then when I screen the client and I know what their needs are, then I decide, do they need program component A and B or just program component A? Sometimes they need actually something different. So we'll call our consultant and enhance, you know, program component B with what the consultant does. So they know their program very well. And if you push, they can actually tell you, well, why, you know, why don't people get A and they get B? And they'll tell you why. So they're a fantastic source of creating a logic model. So there are times when I just have a session with the program staff and I'll take different colored stickies and I'll say, okay, what do you do first? They'll say screen. So I write screen and I put it up there. And then there's the ability to move the stickies around so that you know what the program activities are. And then you go back and you're like, okay, so why do you screen? And then they'll tell you, well, we need to know if they have this condition versus this one and that one. And so then you get at the assumptions as well. So often program frontline staff are a fantastic source of beginning to create what's actually happening in the field. Harder to do maybe in a situation when we're dealing with COVID, but it's still possible. And then we usually send it to them and then they tweak it, but that's been a great way for us to generate logic models for programs. Thank you for your answers. This is great. So I'm hoping that you see the importance of doing some kind of implementation evaluation, and I urge you to really look at some of those fantastic resources that are available. So let's see, we're going back to the slides now. Okay, make a pitch for implementation or process evaluation. And was there anything muddy about that one? I'm just going to go back to the muddy area. Any additional muddy points? Okay, I don't see anything there. All right. So here we go. We are still talking about focusing the design because I want to spend a little bit of time talking about outcome evaluation, summative evaluation. Right now, we have a mature program that's predictable, and we can do an outcome evaluation. And when and why, start with why. Well, I told you about why you can't do the outcome evaluation too soon, right? And someone asked, well, when should we start planning for those? If you do it too soon, when the program is making mid-course corrections, then you might come up with the wrong information about how many people you need and what's the magnitude of change. You know, you have to do sample size calculations, and you have to get together your measures of outcome or your metrics for outcomes. And sometimes outcomes change. Outcomes even change sometimes when they do mid-course corrections. Maybe they thought in the beginning they were reaching too far, reaching too high. So now they have to adjust things to more intermediary outcomes. So there is that delicate balance between planning with enough time to start your outcome evaluation, but then not planning too early so that you have to redo it a few times as that logic model and the program changes. So keep those things in mind. All right. I'm going to kind of go through these quickly. We're still doing okay on time. So I suspect people have seen this levels of evidence pyramid. You know, positivists in particular really subscribe to this, that, you know, the best evidence and evaluation comes from experimental designs and systematic reviews. And I'm mentioning this because I so appreciate the comment in the chat that came earlier, where someone said that sometimes this kind of information is not that accessible to community. So there isn't a lot of support for evaluations because there are other ways of knowing, and I totally agree. But anyway, this levels of evidence pyramid suggests that systematic reviews and experimental designs, and we're really talking about randomized control trials, are the best evidence, the most rigorous evidence. I wish they wouldn't say it that way. I wish they would say that experimental designs overcome some of the most challenging threats to validity. I would be able to buy into that more than suggesting it's the best. Okay, but then if you can't do an experimental design, and actually certainly about 15% or less of you know, public health style interventions are randomized trials. So you have quasi-experimental designs, which are not randomizing people to receive the treatment or not. And that's next. Then you've got case series, case reports, and then non-empirical expert opinion and editorials. So we keep this in mind as we think about our outcome evaluation design, because you want to minimize threats to validity. So we pay attention to internal validity. It assesses the extent to which we can confidently attribute the cause of the changes that we see to the program. And external validity is about the degree to which we can confidently generalize the findings from this evaluation to maybe other populations or other settings beyond what we observed. So I think I hope I did put a document in your evaluation files section that defines each of these threats to validity. But if I didn't, if I forgot to do that, sorry. And you can easily find them on the web. So I'm not going to go over them in the interest of time, but know that internal validity has many moving parts. You have those that are associated with participants, and the most challenging one to address with is selection. So it's worth going over what selection is. When you have a randomized situation where you're taking everyone who's eligible for a program and you're randomizing them to treatment and control, then you don't have this problem where people in the treatment are somehow more motivated for change than the people who were in the control, because they're all motivated for change and to be in a program to make change. When you don't have randomization and you compare people who took the treatment, not because they were randomized there, but because they're super motivated to change, and then you have people who don't want to take the treatment, then trying to compare them and saying that they're good to compare to each other is not appropriate. You're suffering from the selection threat to validity. Okay, so that's the hardest one to overcome. So we have other threats to validity that we need to pay attention to. So that kind of distinguishes, well, it shouldn't really, we should be paying attention to these things all the time. But evaluators pay a lot of attention to minimizing threats to validity. And so we have our internal validity that I just showed you, external validity that I mentioned, whether we can generalize to the larger population, other conditions, other settings, even other outcomes. So there are two ways to deal with it. There's the design stage. So how do we choose designs to minimize threats to important internal validity? Again, can we do a randomized trial or not? Or can we think about other quasi-experimental designs that address issues of selection or other important threats? And we can also do it in the analysis stage. I would say a lot of people focus on, oh, I'm just going to do it in the analysis stage. Because in the analysis stage, we have some tools that help us minimize bias, like instrumental variables or propensity scoring and other methods, which in a couple of years, when you want to come back, we do go over some of these methods in this training session. But I don't think we did it this year. But those are ways to try and minimize the bias that we're talking about. But in an ideal world, you would also consider it when you are doing your design. So for example, I don't know if you're familiar with this notation. If you look in the middle row, OXO, O is an observation, a data collection point, and then X is the intervention, and then O is another data collection point. So before and after, you collect baseline data, do the intervention, and then you collect post-intervention data. That's OXO. That's called before and after. Down at the very bottom, and you don't have a control group there. The first one that has a control group is the second row, static group comparison design. You don't have any baseline data. You just have the intervention, and then you have data collection on the treatment, and then the control group. And the last column tells you which threats to validity are potentially operating using these designs. Anytime there's a control group, you're going to have the challenge of selection. And by the way, none of these are the randomized designs, right? These are observational quasi-experimental designs. So this just gives you a sense of how different designs minimize different threats to validity. And you want to take that into account as you design your outcome evaluation. And here too, there's lots written on that. I want to call your attention to conjointly. This is an evaluation group. I don't know if you know Professor Trochim, who's been doing evaluation for decades and decades and decades, even longer than me. And he has some really great information on design, internal validity, the different kinds of designs, analysis. So his website is excellent and I highly recommend it. It's also not textbook length, so it's very useful. So let me see if I've got time to go over this. Let me see if I can go fast. So I mentioned to you that I was the evaluation lead in the original Baltimore City Evaluation Healthy Start program, the local evaluation lead. I wasn't on the national evaluation team. And each of the 15 sites had a local evaluator. In Baltimore, we had a geographically defined target area. And there were all kinds of requirements that we had to meet. And that target area was intensely targeted for intervention delivery. And we targeted the highest risk areas of the city. How did we know that? We actually created an index of social, economic, and reproductive risk, and we created these heat maps. This is just of one of the indicators, though. This is families living in poverty, but you can see that there's quite a bit of poverty in Baltimore at that time. The brown areas are suggesting between 45 and 70% of families, households lived at or below the official poverty level. So you know the official poverty level is very low income. So we created these heat maps, and the two highest risk areas, we selected those for intervention. And our challenge was, okay, how do we find an appropriate comparison group? Because if we selected the two highest risk areas, oops, where are they? They are here. The two highest risk areas, then we don't really have a comparable area for comparison groups. We weren't thinking when we selected the target areas about the evaluation. So lesson learned, think about the evaluation early on. I just wanted to show you that the logic model had been written out, and it went on and on and on. The program really wanted to make sure that they targeted everyone, including those who typically don't come to programs. So in those target areas that I showed you, they really made sure that they got 70% or more of eligible women to enroll. And they enrolled women when they were either pregnant. So because this is infant mortality prevention program, right? So you can enroll when you're pregnant, but you can also enroll after you've delivered. Because infant mortality isn't until 1 year. So up to 6 months. If your baby is 6 months or less, you could also enroll. So we had two types of enrollees: women who enrolled during pregnancy, and then women who enrolled after they delivered and had an infant 6 months of age or younger. And all of this went toward preventing infant mortality. Why is that important? Because we were trying to identify a comparison group for our outcomes. Local evaluations could only study pregnancy outcomes: low birth weight, very low birth weight, preterm delivery, but not infant mortality. Anyone want to take a guess on what some good candidates might be for a comparison group? For the outcomes: low birth weight, very low birth weight, and preterm delivery. I'll give you a hint. We actually had two comparison groups. One of them was a total bust. So WIC enrollees, that's a good thought. Yes, that's a good thought. For other areas of the city, maybe WIC enrollees. That we didn't actually do that. You know, one of the challenges that I mentioned was in those target areas, those were the highest risk clients, and WIC enrollees from other areas of the city might not have been as high risk. Medicaid recipients, yes. For other areas, we definitely tried that. Part of our problem was we selected the highest risk areas of the city, and so any other area that we went to was not as high risk. Any way we cut it. Other census tracts that are demographically similar, well, we stupidly selected the highest risk areas, and so none of the other census tracts were demographically similar. Those with previous poor outcomes. These are all great suggestions. Thank you. I'll tell you what we did then. Drum roll. Oh, similar cities in other states. Now, actually, the national evaluation did that. They matched Baltimore's target areas with census tracts in Philadelphia, but they weren't as high risk. They weren't as high risk. Okay, here's what we did. One of our comparison groups was, now remember, we had two types of enrollees: those who enrolled prenatally and those who enrolled postpartum. Now, those who enrolled prenatally benefited from Healthy Start during their pregnancy, and the hypothesis was they would have better low birth weight, very low birth weight, and preterm birth outcomes than the enrollees who enrolled postpartum, because they didn't benefit from Healthy Start during pregnancy. The other beauty of this, I think, but I'd love to hear your thoughts, is that they're also equally motivated to participate in a program. Now, the prenatal and postpartum enrollees all lived in that high-risk target area. But because our clients are very mobile, there were people constantly moving into the target area. They were just as high risk, but they didn't have a chance to benefit from Healthy Start because they moved in after they delivered. Remember, there was an intensive outreach program, and we were able to get 70% of, hey, can you get her out? Thanks. We were able to get 70% of eligible people into our program, all right? So, somebody said people in the same area that did not enroll into the program prenatally. Yes, so they enrolled postpartum. Can you think about some of the strengths and threats to validity with this design? Anyway, I think I've mentioned some of those to you. And that is, I don't think we have a lot of, our challenge with the issue of selection is smaller than if we had chosen another comparison group, because they all enrolled in Healthy Start. They all wanted to be part of it. They had similar profiles. So let me just show you. Here we have the treatment and comparison group. The comparison group are the women who enrolled postpartum. The treatment group are the women who enrolled prenatally. And you can see that there are similarities, mostly, with some differences. So interpregnancy interval is shorter in the postpartum enrollees. And then those who initiated first trimester prenatal care was higher in our prenatal enrollees. But otherwise, they were similar. For example, the proportion living below poverty level. Well, it was almost the whole sample. All right. Yeah, tried to keep the dog quiet, but didn't happen. Okay, so is anyone interested in seeing the results? You're going to see them anyway. Here we have it. So the first grid on top is the proportion of low birth weight, very low birth weight, and preterm delivery in the treatment and comparison group. And it looks different, right? It looks better in the treatment group. And then you have the odds ratio in the bottom. And so we were kind of pleased with this. We were pleased with ourselves for being able to think of this group, and they were demographically similar. I think there was one criticism that we can't prove, but is probably partially legit, and that is that it could be that you see the treatment group had higher low birth weight, very low birth weight in preterm delivery. And it could be that because they had a bad outcome, and then they were presented with the opportunity to enroll in Healthy Start, they're like, yes, definitely want to do this. On the other hand, we had lots of qualitative evidence to suggest that women didn't necessarily see this as their biggest problem. You know, if they delivered a week or two early and their baby was healthy, they weren't really, you know, upset about that. That they had many other challenges that they were facing, especially dealing with the issue of poverty and housing security and all of those things that were bigger in their minds than this issue. In fact, when we talked to the community about this infant mortality prevention program, they were like, well, we haven't seen that many babies die. That's not our big problem. We've seen drug dealers on the corner. We want to get rid of them. And many of the young men in their communities were dying at a higher rate than infants. So, you know, whether or not they were super motivated to enroll in the program because they had, say, delivered a week or two early, it's not clear. It's not clear. And we had another challenge of trying to make this infant mortality prevention program relevant for the community. So we dealt with a lot of the issues related to poverty and housing security and urgent needs and things like that. And therefore, that's how they thought of the program. And it was very relevant, more so than it was about preventing infant mortality. Okay, I could go on and on about that. It was one of my favorite evaluations ever. What comments do people have, or muddy points did you put into the Jamboard? I'm just going to check because we have a few minutes. And if you want to, but we don't have to, so I'm going to come off sharing screen. We have 10 minutes. Do you want to ask questions, or do you want to hear about what to do when your intervention is complex and you want to maybe think about developmental evaluation. Maybe you're tired of hearing about evaluation, no problem. We can stop. We can even stop early if you want to. Totally flexible.
Katie shared she'd like to hear about developmental
Developmental
evaluation.
evaluation. What to do with complex? Yes, I think we're facing a lot of complexity. Okay, let's do it. All righty. Oh, I'm doing a valuability assessment too. Okay, let me just tell you, there are ways in which you can, before you start doing a big evaluation, you can actually go to programs and see if they're ready for evaluation now by doing a short evaluability assessment. It determines if an evaluation is worth pursuing now because the program staff are ready for it, they're prepared, they've got the resources, the organizational climate is aligned, all of that other stuff. So the recommendation is to do a short questionnaire to ask them some of these questions. You know, do you have your logic model ready? If they don't have their logic model ready, you can't really do an evaluation. So let's say they don't, and I face this situation often, then we don't say what type of evaluation you want. We just focus on the logic model. You know, so you want to get a sense of whether they are ready for an evaluation now. There's another situation where there was they requested an evaluation, a change in the board of directors, and a change in leadership of that whole organization. So even though before that change happened, they kind of commissioned this evaluation, they needed to get to know their program first before we could really do an evaluation. So we decided to wait, right? You can wait for an evaluation. So it's always a handy tool to think about an evaluability assessment. This is our evaluability assessment questionnaire for one program that we were evaluating. It's a total of 8 short questions. You can see it's short answer, multiple choice. And so it was easy enough for us to determine where to start. Okay, let's go to developmental evaluation. Okay, complex interventions and developmental evaluation. So remember, we've got our formative and our summative, but then sometimes we're in the complex area. I don't know if you have seen and the Kinefin framework. The Kinefin framework suggests that we've got simple, complicated, and complex problems, and then we've got chaotic ones. You just can't control it all. In the simple programs, in simple and complex, in fact, cause and effect relationships are known and repeatable. The difference between simple and complicated is that complicated, sometimes there's cause and effect are separated by time and space, and there's lags, but you can still predict. The examples given in an excellent book called Getting to Maybe, odd title, is that simple, the example of a simple problem is like baking a cake. If you have a recipe, even if you're not a chef, and the recipe is excellent and clear, probably you can replicate that cake over and over again and make an excellent cake each and every time. Complicated is like sending a rocket to the moon. Yes, you need to have multiple types of experts there, engineers and physicists and all of those things. They need to work together. Their protocols need to work together. Probably when you sent your 8th rocket to the moon, you're better and better at it than you were the first time. You can learn, but things are still predictable, even if they're complicated. Complex, on the other hand, is like raising a child. You can't have a protocol for raising a child to get to a certain outcome. And in fact, raising one child does not necessarily make you expert at raising 2 other children or your next child. And so you can't have a protocol for that. It's complex. You have emergent outcomes. And that's what we're talking about when we're talking about complex. So this is the linear situation where we have simple and complicated programs, and you've got your logic model with your resources, inputs, activities, outputs. Here's what it looks like when you got your logic model and your theory of change. You've got your outcomes, and then over time, you've got your activities, outputs, and the kind of evaluation you do are formative and then summative evaluation. When you're talking about complex, you might start out with a logic model, but really that logic model is not that helpful. And you're not sure where to start. And it looks like you're trying different activities in the beginning because you don't know what's going to work. You eventually throw away that logic model. And then you need to see where some of those activities helping me get to the vision and outcomes, and where are some of those activities taking me away, like that bottom arrow, taking me away from the outcomes. I need to stop doing that one. So we do developmental evaluation where at different points in time, we do mini evaluations to sense where are we, and do we continue or do we stop doing this activity? And so evaluation is kind of ongoing at different places of our activities, and it requires a particular approach. So developmental evaluation informs and supports innovation, right? You're creating, you don't necessarily know what the right activity is for this situation, and adaptive interventions in complex dynamic environments. I think the pandemic has been such an environment. Developmental evaluation brings evidence to guide the process of innovation and implementation and adaptation, applying evaluation logic, gathering and reporting evaluated data real time to program planners, and then acting on that evaluation data, making changes, and then starting over again. So when should we do it? The appropriate context is when you have an emergent volatile situation, difficult to plan and predict, no known solutions for that particular situation. There could be multiple paths forward. You don't know which one to take, and you might try a couple. Socially complex, requiring collaboration among stakeholders from different systems and sectors. And often your outcomes, exact outcomes are unknown. You kind of know where you want to go. You've got a vision, but you don't know exactly what impacts you're going to have. Here's inappropriate conditions for developmental evaluation, where people are not able or willing to commit to the time to actively participate in the evaluation. So program planners are over there, they're too busy to pay attention to evaluation data in real time, react to it and make changes. That's not a good situation. If there's not relational trust, not a good situation. Where stakeholders require certainty and they're not comfortable with uncertainty, not the right situation. If they're not open to experimenting and reflecting, not a good situation. If they're unwilling to fail or to hear bad news, again, not a great situation. And then if there's poor relationships between management and staff, that would not be a great situation. So that's just a very quick overview of developmental evaluation. And there's books on it, resources on it. I highly recommend you get familiar with it. It's an uncertain activity to take on, but it certainly is useful when you're facing a situation where you're not quite sure you're doing the right activities. You're really innovating. So I think that takes us to 4 o'clock at this point, and we'll have to stop. Really appreciate your time today. And if you have questions after this session, you know where to find me. And I want to wish you luck on your evaluation efforts as you go forward.
Thank you, Pat. Mike?
No, I just echo that. Thank you, Pat. It's always so so interesting and so enlightening to hear you talk about evaluation. And it's, I think, one of the harder things that we have to do as applied folks in maternal and child health epidemiology. It's something very difficult to do well. Um, so thank you, and thank you for being available outside of this session to answer questions and provide technical assistance on this moving forward. Um, Thank you all for attending, and I look forward to seeing you on Wednesday afternoon. Well, afternoon for me. It'll be whatever time it normally is for you when we meet, where we're going to talk about communication, especially communicating with data. So I have posted a video on the team, so if you can take a few minutes to watch that, and I look forward to seeing you all on Wednesday.
Thanks,
Bye.
Paul.